Hi there, Jen Russell coming to you with some more tips and ideas on how to move and feel better in your body. Today, this video is going to be geared towards my pregnant ladies, my prenatal ladies. If you are currently pregnant, you know someone who's pregnant, feel free to share this video with them. These are going to be some concepts and ideas that I go through with pretty much every client who comes in to see me. These are going to be more broad and general ideas on positioning, alignment, ways to move a little bit more safely to try and offset some of the discomforts that happen most commonly, not only during pregnancy, but postnatally as well. So this is not a particular strength training program per se. If you are interested in that, I'm actually going to link some programs that I've either vetted myself or have been recommended to me by trusted colleagues at the bottom of this video in the comment section. But the first thing I want to talk about is the positioning cues or alignment cues I've gone over in all the other videos, because they are the same whether you are pregnant or not. They just get a little bit harder to maintain as we get further into pregnancy. So those again are nice long neck, chin tucked back, chest nice and wide, ribs slightly pulled down, and hips relatively even. So as you start growing a baby in the front of your body and your center of gravity starts shifting, your abdominal muscles start getting lengthened and stretched, we can develop the pregnant waddle, wherein the hips enter the room before the rest of the body. So the first thing I want you to think of is just bring a little bit more awareness to how you are moving through space. So say you pass a mirror, take a look. Are you hanging out here? Well, maybe just try and shift your hips back just a little bit. Try and pull those ribs down a little bit, because we want to keep as much connection to our abdominals and to our intrinsic core system as possible. That's going to not only help us to have less pain as we go through pregnancy, but it's going to help us labor and deliver better as well. If you've watched any of the other videos, you know I've talked about the concept of the intrinsic core system before. Those are muscles and tissues whose main job is to help us to breathe and to stabilize our spine. The top of that system is our diaphragm, the bottom are our pelvic floor muscles. So as you're walking through space, I want you to imagine you're trying to keep that alignment as ideally as possible, as optimal as possible. So trying to keep those ribs over the hips. Try and avoid hanging out here. But also, don't walk around holding a kegel. So I've gone through, you can check out my breathing videos for more information on how we want to coordinate those muscles of inhalation and exhalation. But for right now, I just want to give the idea that kegels are often the only cue or exercise that women are getting from their OBs in terms of connecting them to their pelvic floor muscles. And that's a very, very incomplete, and I won't say totally unhelpful, but it's a very incomplete exercise, because the pelvic floor muscles are supposed to work as a team member with the rest of the intrinsic core system. So I'm going to do another video where I'm going to go through what's called a quadruped rocking drill, and I'm going to go into a little bit more on how to coordinate pelvic floor to the abdominal muscles. I'm not going to do that in this video, but definitely check that out to get a little bit more information about how we can coordinate those kegels with the rest of the core. Okay, but for right now, I just want you to think about your alignment when you're walking around. The second two things I want to talk about is the difference between a hip hinge and a squat. Because as you get further in pregnancy, you're still going to need to be able to get in and out of bed and on and off the floor. So you might have another kid that you have to pick up off the floor. So I want to talk about the difference between those two movements, because those are really important movements, not only if you're pregnant, they're really actually, all of us should know how to do them all of the time. Because a lot of times what happens, I've got my daughter's little doggy here, drop it on the floor. What ends up happening is we want to get something off the floor, we end up bending solely from our lumbar spine, our low back. We end up loading that tissue. We bend down and now we pick something up with that load, and that's what powers our movement. That's a really, really suboptimal way to pick something up off the floor. We're really not using all of our muscles in a particularly well-coordinated way. We're not load sharing very well when we do that. So the first thing I want to go through is what's called a hip hinge. So I like to think of it as someone comes and karate chops your hips. So your hips are going backwards. So someone comes, karate chops, boom, and our hips go back. the rest of our spine stays nice and stable. It stays in alignment. All those positioning cues I talked about before, they still stay nice and neutral. So we're not going like this. We're keeping everything stable. We come backwards, and then we can allow our knees to bend. You're not gonna win an award for being able to touch the ground without your knees bending. That's perfectly fine. And then we come back up. What you should feel on the way down is a lengthening or a stretching in the hamstrings, the backs of the legs, and the glutes. And as you come back up, you should feel those activate. If you want to get real fancy, you can coordinate with your inhale and your exhale. You can inhale, get down, exhale on the way up. So that's a hip hinge, and that's a really, really wonderful way to pick things up off the floor, to brush your teeth, to get dishes out of the dishwasher instead of bending and having all of this pressure through our lumbar spine. The second movement I want to talk about is the squat, but specifically getting yourself into what's called half kneeling. Because as you get further into pregnancy, if you have to get down on the ground, which most of us do, what I often see is this sort of approximation of a squat where but we're still kind of putting a ton of pressure in our back. So instead of doing that, I want you to get yourself into a staggered position and then go down from there. So it takes a decent amount of energy and coordination between our glutes, our quads, our hamstrings, but a heck of a lot less pressure in our back. So we'll do it from the side. And then you can get down on the ground, do whatever it is you need to do, pick up something. Now, if you have the strength and you don't have too giant of a belly that you feel like you're gonna fall backwards, try and do it without any assistance. You wanna get down on the ground, pick something up, do what you need to do, and then push yourself evenly up. Towards the end of pregnancy, you're really exhausted. You're kind of inclined to be down there and do the thing. Please don't do that. You're really, really potentially gonna hurt your back. But don't be afraid to get yourself in a position where you get a little help from a table or your spouse. Don't be afraid to use assistance to get yourself into that half kneeling and then push up from there. But that can be a really, really safe way to get yourself up off the ground without doing that. Basically using every other muscle except for the ones that you mean to be using. So those are just a few of the ideas that I like to go over with, general ideas on how to move a little bit more efficiently and optimally as you get further along in pregnancy. In the next video, like I said, I'm going to go over what's called quadruped, is the hands and knees position, and working on trying to lengthen and stretch a little bit in the low back and coordinate it with your breath and your pelvic floor muscles. So definitely check that out. Feel free to reach out if you have any questions, and feel free to share with anyone you think might be helped. So if you are pregnant out there, congratulations. I hope it's going well. Whatever you're doing, you're growing a human. So that's freaking amazing, and you're doing awesome. Just be kind to yourself, have a sense of humor with yourself, and know that whatever you do, you're doing your best. That's probably should be the theme for all of us in 2020, right? We're all doing the best we can. But definitely be kind to yourself, and please, please ask for help. So be well, be safe, and thanks for watching.